As a neurosurgeon, I've seen and done some pretty crazy things, but one of my most unusual cases actually involved a balloon. Here's the scenario. A middle-aged woman was having an elective procedure, so as an outpatient, having an aneurysm obliterated. And in the old days, what they used to do is they would have detachable balloons, and they would put a guide wire up through the blood vessels into the brain, and then they would release a balloon right where the aneurysm is to block the aneurysm off from the blood circulation. In this specific procedure, the balloon actually detached early, got into the blood circulation, and ended up blocking a major blood vessel feeding blood to the brain. So this person literally had a balloon stuck in her blood vessel, and if this balloon wasn't removed, she would end up having a large stroke into her brain and potentially die. She needed emergency brain surgery, and that's exactly what we did. She was taken to surgery. I exposed the blood vessel, and I actually had to take a small knife under the operating microscope, cut into the blood vessel itself to open the blood vessel. Then here's this little balloon that I just took right out. And then I had to reclose the artery, sew it back together, and then hope it didn't leak. It was a very tedious and dangerous surgery, but I was able to sew the blood vessel back together in a watertight fashion. We restored blood flow to the brain, and we averted her having a stroke. And she actually did very well afterwards and was back to a normal life. Those balloon systems are no longer used much anymore due to the risk of complications, and there are much safer, more effective ways to treat aneurysms.